度一次，现在我们看到仍然在上升，所以大家应该减少外出，保持警觉。如果可以的话，公司应该安排在家工作。我们知道有些人很奇怪，我们为什么会以呈报的数字不用阳性的数字？其实我们不是隐瞒初步阳性的数字，我们觉得呈报的数字更加可以反映速度。我可以跟你们说一说初步阳性的数字。昨天凌晨的数字是9369例，前天同一个时间是8137例，在前一天是7564。初步阳性的数字以前的确可以反映最新的情况，因为私人化验所他们呈报了个案以后，很快就可以把样本送到我们的公共卫生化验所，然后公共卫生化验所就会很快可以确定是否确诊。比如说昨天我呈报了确诊的数字，就是昨天初步阳性的大部分就是确诊。今天我可以说，今天他们现在初步阳性就可以估计明天的数字。但是现在的情况，每一个环节可能有一些滞后，有些初步阳性几天还没有确诊，所以数字不能反映上升的速度。另外，截至昨天超过300例，就是老人院的一些个案，不一定是很多的个案，有些可能是几例，是一些住院的人或者是他们的员工是快速测试，或者是一些阳性的个案，有超过300个老人院。其中早前的数字，昨天的就是超过230位员工，还有超过800名的住在院舍的人初步阳性，或者是有其他的个案。有些是快速抗原测试的数字，把它们呈报上来了。我相信真实的数字是更多。有些人可能在社区，如果是初步阳性的话，政府资讯科技办公室的人会把他们戴上手带。有些人以为戴了手带就不用进院，其实是在等候的时候戴手带，跟进院是两回事。
So we actually arrange a quarantined area for those who are suspected of the COVID-19 infection. I think all of you should obey the basic rule for the prevention and control of the COVID-19. So I'm like to give the floor to one of my colleagues. Currently, we have 3,377 people who are confirmed cases of COVID-19. This is the number from the Hong Kong's COVID-19 Prevention and Control Bureau. Apart from that, we also have 1,997 people suspected of the COVID-19, among which 256 of the suspected cases is quarantined in the frontal bay of the Hong Kong regions. The number is a little bit delayed or postponed because of the infected numbers, and we are lacking detailed materials. So these are some of the numbers that I have at my hand. I can share with you. There are 19 patients who is in the critical conditions, and their average age is between 15 to 96 years old. Among which 15 of them are male and 15 of them are female. In the past 24 hours, there are 32 infected patients who are passing away in the past 24 hours, and among them, 14 of them are female and 3 of them are male. For these deceased people, the majority of them belongs to the elderly group. They also have some the underlying disease or comorbidities, and they are not vaccinated. For those who is for the patient who is around 45 years old, he suffered from a very severe conditions with other different underlying disease. He need to stay in the bed for the long term. That's the reason why if you are seeing some of the deceased are young people, but their body conditions are actually worse than those of the elderly group. They also suffered from a long-term underlying disease. 7 of the patients passed away on the 22nd of February. Among these 7 patients, the age is between 66 years old to 93 years old. There are 5 male and 3 female. This is what we call the 5th wave of the COVID-19 pandemic. So far, we have 149 of the patients deceased or passed away in hospitals. The COVID-19 pandemic has been broken out for the past 2 years. There's around 300 people passed away in the public hospitals, and we have discharged over 3,000 people. And there is around 90% of the bed occupations in the public hospitals, and we are reaching to the limits of the bed number in our public hospital. For around 50 patients, when they are hospitalized, we find an early stage of their positive symptoms. Around 30 patient is being listed as a close contact. So far, there is around 373 people who is affected by the COVID-19. I also want to report to you that we are signing and negotiating with 4 hospitals about the treatment and transferring of the severe patient. For the St. Paul Hospital, they are going to give us an extra 20 ICU beds to support the prevention and control of COVID-19 patients, and we are really delighted that we are setting an example for these private hospitals to can receive the arrangement of the COVID-19 patient. And we are also calling for those of the citizens. Recently, we find there are some of the people upload the video clips, which is shouting the mask at our medical workers. And for the public health bureaus, we are calling for all of you to encourage the medics. We have an overwhelming wave of the patients, and the medical workers are really trying their best and ramping up all the medical beds for the patients. And for our public management bureaus, we are also talking with the government to increase the hospital beds and also the quarantining areas in the community levels. And we have arranged a lot of hands to fight at the front line of the COVID-19 pandemic. We even arranged doctors from the orthopedics and also the surgical department to be a part of the prevention treatment of the COVID-19 wave. Some of the clinical beds are reallocated into the part of the treatment of the COVID-19 pandemics. We are in a severe situation, and I believe that all the medics are adhering to the principles of saving lives. I think we are fighting the COVID-19 at all fronts of our social lives, and we need to let the medical workers to focus themselves on the treatment of the COVID-19 patient. We are reporting to you every details of the facts, and we are not going to let the rumors dismear the dignity of our patient. And please do not transfer these videos. Now the floor is open up for questions. Please identify your affiliated institution before the questions. So hi, it's really an honor to meet you. I'm with TVB.